The definition of apnea is cessation of breathing. It's where you stop or have some diminished breathing. Therefore, sleep apnea is where you may stop or have some diminished breathing during your sleep. By the time somebody gets to us, it's actually usually because of a family member or a bed partner complaining of their excessive snoring. However, if you're having some routine fatigue and or sleepiness on a daily basis, it's probably a good idea to get checked out. You might not be getting a quality rest at night. Most people that have excessive snoring, meaning loud enough to bother others, usually have some degree of blockage in their airway. However, not everybody that snores has sleep apnea. The flip side of that is that most people that have sleep apnea do snore. No, snoring isn't always a symptom of sleep apnea, yet yes, it is part of most obstructive sleep apnea patients. However, there is another kind of sleep apnea called central sleep apnea. This is more of a central nervous type of sleep apnea where the patients don't always snore, especially if the patient may be laying on their side and may not have quite the obstruction that an obstructive sleep apnea patient may have. There may be some snoring, but not enough even to bother other people within the same room. The biggest population of sleep apnea patients is actually males ages 40 to 65. However, we're seeing more and more younger folks as well as women come through that are complaining of fatigue and that sort of thing that are testing positive for sleep apnea. Untreated sleep apnea can lead to many problems down the road, such as high blood pressure, could lead to heart attacks or strokes. It also makes diabetes much more difficult to control. Sleep apnea is diagnosed through an overnight sleep study. A patient would arrive at the sleep lab and be prepared to spend the entire night with us. A technician would be monitoring both quantity as well as quality of your sleep throughout the night, looking for any interruptions caused by the cessation of breathing, which may cause you to lead to a poor night's rest. There are many treatment options available for the sleep apnea patient. The gold standard currently is still what they call a CPAP machine. It stands for continuous positive airway pressure. It would be a little device that the patient wears on their face during their sleep at night. Helps open up their airway, keeps them breathing more consistently. If you're not stopping breathing at night, you're not waking up to start breathing at night. And that's what our ultimate goal is. The CPAP machine also prevents any snoring during the night. There are other options for the patients that are unable to tolerate the CPAP machine, such as airway surgery and or oral appliances. But currently, CPAP is still the gold standard. By far, CPAP is the most usable treatment option for the most amount of people. There are those patients that just cannot tolerate something on their face due to claustrophobia issues and or pressure points, that sort of thing. In those candidates, especially if you have a mild to moderate case of sleep apnea, then the surgical options and or an oral appliance is a good backup option. Here at Shawnee Mission Medical Center, we do pride ourselves in putting the patient's needs first. We do this in a variety of ways through the Sleep Disorder Center. We are a nationally accredited sleep disorder center. Therefore, we have all registered technicians that work in our facility. We also have board-certified physicians that take special care in diagnosing each patient so that they get the best possible care. Within our lab setting, we try to make the patient as comfortable as possible. We have all queen-size beds. We have personal bathrooms going along with each bedroom. And we also have both TV and internet access available to the patients before their sleep study begins. One of the main reasons that somebody should come in and get their sleep apnea treated is you don't have to live with the fatigue. You don't have to live with the day-to-day consequences of adding caffeine to your diet or other things that you may be doing to compensate for how fatigued that you are during the day. As well as people that are sleepy during the day are putting not only themselves at risk, but other people at risk as well. Those that are driving sleepy behind the wheel really are at a greater risk for having motor vehicle accidents, therefore risking not only yourself, but others that are on the road with you. My name is Stacy Peterson, and I am the clinical coordinator of the Shawnee Mission Medical Center Sleep Disorder Center.